Hello, welcome to my section of the IRSSD 2023 virtual meeting. I would like to share with you this project named the Children's Spy Care Community Project. This is funded by the Hong Kong Jockey Club Charities Trust in collaboration with the Department of Biomedical Engineering, Hong Kong Polytechnic University, with the Six Yin Charity Organization, aiming for improving posture awareness and management of adolescent idiopathic scoliosis. As you know that bad posture may lead to musculoskeletal symptoms, respiratory and cardiovascular disorders, imbalance, fatigue, and pain, as well as appearances and performance issues. While adolescent idiopathic scoliosis, AIS, is a three-dimensional deformities of the spine at a time with lateral curvature and vertebral rotation. So over 80% are with unknown causes, we name as idiopathic, and most cases are adolescents. So in Hong Kong, about 11,000 children per year suffers from spinal problems. It's one of the top 3 health problems in Hong Kong. So there are some limitation of current services in Hong Kong, though we have school screening. Based on the report of Ombudsman in 2019, only 65% of the children participated in the screening program. So because it is a voluntary screening, children need to go to the assessment center to have this screening. It also is a biannual screening. This is a relatively long screening interval, almost 24 months, because students are required to go for screening in primary 1, 3, 5, and secondary 1, 3, and 5. And also, normally they will refer to the 2 biggest scoliosis center, one located in Prince of Wales Hospital in New Territories, and the other one is the Hong Kong Island side, the Duchess of Kent Children's Hospital in Sandy Bay. This is relatively long traveling distance, as well as the hours of conflict for studying, like the school children, they need to go to school for the very busy schedule, as well as the parents, they need to work, able to pick them for the services. Now, with this project in place and other possibilities for the patients to get the services that are closer to the central of Hong Kong, that is located in the Hong Kong Polytechnic University. So the project objectives would like to improving the awareness of posture and what does it mean by AIS, as well as provision of services from education to treatment and support, or aim to reach the unreached. And through the education screening in the school, we'll conduct on-campus talks, exercise training, and screening to educate, train, and assess the students. We also provide service and mutual support, aim to provide treatment, mutual support activities to improve the treatment efficacy and promote quality of life. Reach the unreached is our aim. As I mentioned, those high-risk student groups, including primary 4, 5, 6, as well as secondary 1, 3, 1, 2, 3, will be included. That means this 6 years risk period will be taken care of. The arrangement, what to do is talks and exercise, scoliosis screening, referral for further assessment and treatment, where to perform, in the school auditorium, assembly hall, screening, curtains area in the classroom or hall, for further services in PolyU, when during the school hours all children can be involved. And we try to arrange along school hours to provide such services like in the late afternoon as well as on Saturday and even Sunday. Who, of course, the school children, the students, parents, and teachers. It takes about half an hour to conduct this talk and exercise. For primary grade 4 to 6, about 100 to 200 students, or secondary school, same number as grade 1 to 3. It takes about 3 hours for the screening. If we find through use of the scoliometer, the ankle trunk inclination more than 5, we'll have a further investigation together with some clinical sign. Then we will confirm the diagnosis with X-ray assessment. For mild cases, we will teach them to do some exercise. For moderate cases, we will offer orthotic intervention together with the exercise. For severe case, we will refer the patient to public or private sector. The students normally arrange as such, as mentioned before. In the school, provide education and exercise training in the assembly hall, and then go for screening in the screening room. For those tests with negative, we will issue a letter to the parents, because we need the parents' consent, right? Written consent to ensure they allow their children to have this screening. For those positive cases, we will have a further diagnosis in PolyU to see whether this is just mild case, moderate case, or severe cases in our clinic. So what's the potential benefit for the patients or students? More convenience and accessible service with education, exercise training, screening, and management. More timely treatment from primary 4 to secondary 3, and more children-friendly, radiation-free in assessment and monitoring, except one X-ray taken for confirmation of spinal deformities or whether the patient got scoliosis, and one for in-place corrections. The other assessments, like a macular assessment, will use non-invasive methods such as ultrasound imaging. And we'll have a more peer support and for better quality of life for the children. Here I show you some photos related to the talk, exercise, and screening in the school. We also provide the talk, exercise, and screening services to the children from the subdivided unit and the ethnic minority, while the non-government organizations. You can see that both the children and their parents also involved in the talk and doing the stretching exercise for the benefit of their back. Here is to show how we conduct the screening in the school. And here is the outreaching team. We train our students, undergraduate and postgraduate students, who conduct this preliminary screening in the school. Here is our research and clinic team, including different disciplines. We do have challenges to share with you. including this project start in October 2019. By that time, Hong Kong got a social unrest, and PolyU was occupied in November 2019, and we opened in January 2020. And COVID pandemic has been affecting since February 2020. That means 1 month later after the reopening. School reopening from April 2021. Up till now, we have served beneficiaries up to August 2023. We have served more than 12,000 children from 50 schools. We mainly focus on those schools in the low income districts and provide service through 5 NGOs, those children from subdivided units and ethnic minority. So this project got a target number. We aim to serve 21,000 children. This project serves as a pilot study, which they enriched. Okay, here we can test this is really useful, really benefit, more really feasible. Then we will write a report and promote to the Department of Health of Hong Kong. We do have some specific findings that AIS incident rates increases during the pandemic period due to less regular screening in the Department of Health, fewer physical exercise and outdoor activities done by the children, more home stay for electronic games, or keeping in proper postures. That's all our observation and in communication with the children and their parents. Of course, by the time of physical meetings, IRSSD 2024, we would like to share with you more analysis about these pilot studies. Talk about the next meeting, physical meeting. I would like to see you in Hong Kong Polytechnic University. We, through this physical meeting, we reunion again after these several years, mainly virtual communications. So we'd like to see you in Hong Kong. Thank you very much for your attention.